Good day, it's Dr. Doug Pernikoff of Dr. Doug's All Things Animal Radio Show, and my lovely co-host, who we missed last week, Miss Cindy Vickers.
Coming from Australia. Good day.
Good day. Good day, mate. So I didn't know you've been to Australia. I always wanted to go there.
I have a wonderful Brian Merlot, my wonderful
You have a
Aussie
wonderful
friend.
butt?
So Brian is my most favorite Aussie. Brian Merlot.
Is a friend of yours?
A friend of mine, yeah.
Okay, because Merlot is a wine.
My book club friend. And friend.
So we missed you. Did you have a good time last week? Whatever you did? Busy private business, or you don't want to?
Very private business.
Okay, we won't even
I
suggest.
made a lot of money.
Oh my God!
And
I didn't know you could make a lot of money babysitting.
I can't talk about it.
Anyway, we are here
Look at
today.
the time. I gotta go.
I know. I'm
I got
sorry.
stuff to do today.
We're here today, and we want to discuss what the value of the yearly pet wellness exam would be. Why do people have to do this? Why do veterinarians encourage it? And I think Cindy's about ready to bring lunch up. She's so excited about this particular show topic, but it's really important because, I mean, don't you,
interesting.
Oh, don't you attend to your dog's average needs every year, annual needs?
First of all, I don't have a dog right now.
You don't have a dog right now?
No.
Oh my God!
No, I know it's horrible.
I don't think I've ever known you without a dog.
You have never known me without a dog, and we could just spend the whole show talking about how I don't have a dog and why that's so sad.
It is sad. I think for any person not to have a dog.
Yeah, I miss having a dog.
Deal.
I have a cat. I have Russell.
Well, you take your cat to the vet every year.
Sure.
This is going to be a really great topic.
I don't want anybody to hurt him.
So really, as a veterinarian, this is key to my life. And, you know, my job is to keep critters healthy, happy. And we also, not only physical health, but we also want them to be emotionally happy. So that comes into some discussions we have often with our
I'll jump in for that part.
Yeah, our pet owners. And God, I'm going to have to put a whip on you. You're gone 1 week and everything's crazy. But again, the veterinarian's role is to help the owner understand how to look at things, look at your pet, understand what's normal so that you can then understand what's abnormal. And that's the best way to recognize something different in your pet. And there's obvious things, obviously, if they quit eating, if they're having the blood in their urine or their stool, those things are apparent and they drive you to the vet right away. But on an annual exam, we're kind of looking ahead of time and we're kind of doing what we call a preventative care. We're going to check your pet out from head to toe and everywhere in between. So that's really critical.
The everywhere in between part is critical?
That's critical too.
Okay, I just didn't know if the head was critical, the toe was critical, or the in between.
Oh my God.
Most critical. I'm just trying to make
I just
sure
want to
that
know
I'm
what
doing
you
due
had for
diligence.
lunch. Really.
You know how you're all about due diligence. I'm
That's
just
true.
helping.
That's true. But, we can talk to things to our pet owner. We can talk about general behavior. We can talk about diet and manage that with them.
Bad hair days.
Bad hair days.
For your cat or dog. Because if they had a perpetual bad hair day, there could be a health problem underlying.
That's very true.
That.
I mean, we're joking, but we see animals come in matted, and underneath the mats, a lot of times you get hot spots.
Or suddenly they're losing hair, or
Yes.
it's
Over-grooming.
very, very dull, or it's got lots of scaly stuff.
Well, one of the big indicators in cat health is just that if they don't come in and they don't look well groomed, they're not grooming themselves and cleaning themselves, it's one of the first indicators that something's amiss.
That's why I said it.
So you are so bright. That's what really excites me.
I know things.
And then, of course, there's exercise, and I think exercise, as much as it's about the care of the animal and the physical well-being, but I also think it's more important if you exercise with your pet owner, then you have activity. And activity means relationship. Relationships means stability. Stability means a long time together, healthy and happy.
Stop. So is that why you have such a regimented exercise program for yourself
I do,
and your
yes.
dog?
Yeah, I'm
okay,
very
good,
regimented.
because you know how important that is.
That is. It really is. If everybody could see me, all my listeners, you'd understand because I'm such a svelte human being.
Fit as a fiddle is what we like to say.
Fit? Fit as a fiddle?
Fit as a fiddle. Have you heard that?
Well, I'm sort of built like a large bass guitar, so I'm not sure if that fits, but it's nice of you to say so.
So, you're welcome.
Okay. So part of I forgot what I was talking
I
about.
lost my place.
Part of our examination starts by a history. So we talk to the owners and we say, owner, and you're going to be the owner. And
Okay.
Okay.
You call me Cindy.
Okay, Cindy, I'm just wondering, how has your pet Bootsy been doing all year?
Well, the thing is that he's gotten kind of lethargic, and
That's a big word.
My cat lethargic, yes, that I study, and he just isn't kind of grooming himself. Like, he just does his paws and his head, but on his back and kind of the whole hip area. Not, it's getting.
And how long has that been going on, would you guess?
Oh, how long? Ooh, my gosh, I don't keep track.
I mean, over.
I'm going to say, maybe even most of this year.
Okay, there we have it, an example of a very irresponsible pet owner. So when you see things, what's the first thing to do? Call up your veterinarian and come on in.
Oh, yes. And, well, you know what? I really actually said that because I'd seen, cats who they are lethargic, but there's this combination of them getting slower and fatter, and then they can't, I don't think, reach their whole body very well, so their grooming declines, and it seems like there were so many times where then fatty liver disease came into play, and their hair they start to lose it in
You're
clumps, and it's oily.
You're a name dropper.
Yeah.
I think that's true. So again,
Was that right?
Yeah, exactly. In getting a history with the owner, you want to know, how are those behaviors? Is your pet eating well? Do you see normal stool production and urination patterns that are normal? I mean, I had someone come in today and tell me, my dog's been really doing excellent, but I notice sometimes she'll go out and she'll strain to urinate multiple times. And then even sometimes as she's walking, she'll just be dripping a little bit of urine. So she's not really incontinent. And incontinence means that your pet wakes up from a sleep and there's pee or urine all around. Then you know that they're not realizing that they're leaking. But in this case, it was justified to drive us to do a urinalysis to try and understand. So the annual exam can include starting at the head, working down after we've got our history from the owners. Then we do a physical exam on the external parts, and we look everywhere we can look. So we have devices that allow us to look into the eyes and see if there's any changes in the eyes, like cataracts. And then we look into the ears, because the ears are a source of chronic issue for many animals. And then we move on down, nose, mouth, look in there. And what are we going to see in there, Cindy?
Well, you could see teeth that have decayed, or just have really, really heavy plaque on them, or sometimes they have foreign objects in their mouth. I've seen that actually. People are so unaware of their pets that they. I think we mentioned this one time. It was not just their mouth, but so you're really looking for the health of their teeth and their gums when you look in their mouth.
Right. And that's really important, because we're going to encourage dental reviews at least twice a year. And if somebody is having a problem, usually it's the smaller breeds that tend to accumulate a lot more tartar and plaque. And sometimes I'll see a large breed, medium to large breed dogs, anything over 60, 70 pounds or greater. Often they'll live an entire lifetime with maybe once or twice a need for some kind of dental care.
So I specifically know of a little dog who the owners were trying to determine what is wrong with this dog, because it would yelp just sometimes, and the times that were frequent were like if it jumped off the couch, so it hit a surface, kind of abruptly, and it would yelp then, and looking at hips and knees, and it was their teeth.
It was the teeth.
Yeah.
Wow.
But can you imagine, it jars something, your whole
see.
body kind of gets jarred when you jump and hit a hard surface, and it would, they would feel it in their mouth.
Well, they do get, all animals have the potential, including humans, commonly get problems as they get older in their temporal mandibular joint, which is the upper and lower jaw that comes together.
Yes.
Very good.
Yes, the people who are listening didn't see that.
No,
a light bulb moment was for me. I knew what it was.
And
I know my anatomy.
Well, Cindy was so bright, she actually pointed to her face. and I thought she was pointing at a pimple, but it turned out she was pointing at the jaw. It was excellent. So you're right, that's true. And one of the things you alluded to just then was that we look at, not only do we look at the physical structure, we like to see the animals move and make sure they're moving well. We ask questions about how easy is it for your pet to get up and get down every day? Are they trying to jump up and down on furniture? And again, it varies depending on the breed, the size of the dog, whether it's a purebred or not, anything we know about the genetics of the particular dog or their own breeding. So again, it's kind of like an investigation. We have to play like we're trying to search out some kind of issue. And
well, another thing that is timely about this, so it doesn't matter, you may have had your pet for a short time or a long time, but in the spring, it is a great time to acquire a new pet. It's probably maybe the most ideal time,
I think you're
arguably,
right,
for getting them. And of course, any time now, kittens are going to be in abundance.
Mm-hmm.
So a lot of people are going to be bringing home a new puppy or particularly a new kitten or two. So there really is no skipping a really good exam, right
Yes.
from the get-go.
Well, I would jump in and say that I always tell my clients, if you're looking for a new pet, make sure they give you some opportunity to a 72-hour period to get to the vet for a new acquisition or a new buy kind of exam. And then the other thing I tell those people that I'll jump in and add is that they should ask the people they're buying the dog from or the cat or they're adopting from, they need to get whatever medical history they can get. Or even find out what the name of the veterinarian is that's working with that group or working with the individual family, because then we can go to them as the new vet and determine if there's any kind of issues with care or what's deficient, what isn't.
Are vets generally congenial about sharing information like that, or
Doesn't always happen, though.
Yeah, some people go like, "What?
I
That was
know.
my client, and you took it."
Wow. And then as we get into the exam, of course, the veterinarian's going to put a stethoscope on that allows them to listen to the heart and lungs. We call that auscultation. Big word. You can practice that, Cindy, one time.
Auscultation.
Oh, my God. And
Thank you.
and you can even listen to the abdomen, because the abdomen, sometimes you'll hear strange gas sounds. And,
Abdultation.
yes.
No, it isn't.
No, but it sounded good. And we call that abdominal auscultation.
Seriously?
Yes.
Oh, because of osculating of whatever the area is.
Yeah.
Okay, I got it.
That's very good.
I'm with you.
And then we've got all this overview done, and we look at our pet, and we look at our owners, and we say, your dog is 8 or 10 years old, your cat's 15 or 16 years old. Just like you going to the doctor, there's certain things your doctor's going to suggest that makes good medicine sense, and that includes an occasional blood exam, and that kind of reviews all your organ systems to make sure everything's going well. And then if you can, and depending again on the situation, an EKG, or what we call an ECG, electrocardiogram. Cindy? Electrocardiogram.
Electrocardiogram.
Good. And those are other tests.
Okay, that's the last time we're doing that.
Okay. And in other cases, we might need to do a radiograph, and we can offer even
Well, now I don't know what that
ultrasounds.
is. Radiograph?
That's an X-ray.
Oh.
X-ray. So, if you have an animal that has a history of any kind of problems in the abdomen or in particular in the chest cavity, or we even do, some facilities will be able to do dental x-rays to make sure that the roots of the teeth look good. So these are all options. And as veterinary medicine has developed, it become very much more sophisticated in the technology that we use and have available to us. We see that the average lifespan of the animals is going up and up and up. So what we used to say, a big giant breed dog, we'd say would live 7 to 9 years. Now we say they live 9 to 12. And we say the same thing for small breeds, that they might have lived to be 12 or 14. Now we expect them to live 16, 17 years easily. And I've seen cats 22, 23 years old. I've even seen one shepherd that was 22 years old, which was pretty amazing. So.
Well, is there, you talked about just one example of your dog or your cat having problems urinating and that you should call your vet. So what are the possibilities of what might be wrong if an animal was struggling to urinate and I mean, obviously they could have a bladder infection, but
Well,
what's causing these, or is there a way to
okay.
prevent these things too?
Yeah, sure. I mean, depends on the animal and the situation, but you always want to rule out the possibility of some kind of urinary stone if they're straining and nothing's produced, especially in any male animals tend to have a narrower urethral opening through where the urine passes through, and they're going to be more prone to obstruction if they do have a stone or too much what we call grit in the bladder. It can actually block them up, and that's a life-threatening concern, because within hours and hours and hours they can get what we call uremic poison. Everything gets backed up, so things that would normally be metabolized away or urinated away or whatever, now all of a sudden those things are being recirculated.
And you're talking about very toxic bacteria that's being backed up.
Can be, well, it's not necessarily bacteria. It could be chemicals like urea, or can be things that would normally be metabolized through the kidneys and then urinated away. Suddenly can't go anywhere, so they get reabsorbed and they start poisoning the system. So we're going to go ahead and stop for just a moment, take a quick break, and then we'll come back and continue this amazing discussion. I think we have some phone calls online, too. We can ask some specific questions. So this is Dr. Doug from Dr. Doug's All Things Animal radio show, and Cindy Vickers, my great, amazing, intelligent co-host, who is a little off today.
That's not so.
No, it's not?
No, I am.
She's sharp. She's sharp today.
Yes.
Okay.
Thank you.
And we'll be back in just a moment. Thank you very much. Welcome back. We're into our second segment regarding the value of annual exams for our pets. It's Dr. Doug Pernikoff of Dr. Doug's All Things Animal radio show, and Cindy Vickers.
And kind of things that are just related to having your pets in the spring and summer.
Okay. Go ahead. Continue.
No, I'm just saying what we're talking about. I'm adding.
We just talked about some of the exam capabilities. We didn't mention vaccinations, and every veterinarian is going to have their own kind of protocol and the reasoning behind it. So I think that's something that should be very specific to your veterinary relationship. He may say, this vaccine you can do every 3 years, this one you can do every 1 year. Some people say, well, can we just do titers, vaccine titers, and see if we even need to do another vaccine, because a lot of people have become much more sensitized about using vaccines in not only animals but in humans as well. But I didn't want to elaborate too much on that because we have some interesting phone calls online. So let's take a first call. Let's talk to Jeffrey on line 3. Hello, Jeff there.
Hi, yes.
Hi, this is Dr. Doug Pernikoff. Can I help you?
And this is Cindy.
And Cindy?
Hi, Cindy and Dr. Pernikoff. I have a couple of questions.
Oh, okay.
Number one, when you have your dog in the car and you have to run into a store and it's like in the 80s, and if you roll the windows down a little bit, is that safe for a dog?
I don't think that's adequate. I know for a fact that even at 70-degree weather, a dog can be in the car for 10 minutes with the windows partially down and become heat prostate and can be life-threatening. So 80 degrees with the windows down to me isn't great. And it depends on the car. But
And he also said partially down, too. It's not like they're even completely open the dog's heads out.
yeah.
So
I mean, if you can, park the car in the shade, and then you're going to have a better opportunity. But then, it's just not a great idea to leave them unattended in the car like that in that kind of weather anyway.
Okay, I have another question that I mentioned when I called in. I was looking at various dog breeds, and I don't know too much about them, but someone told me that French bulldogs are nice dogs. Would you mind giving me an opinion of that?
I would never have one.
no, horrible. They're horrible dogs.
Actually, I have one right here.
Yeah.
Bruno is right here today with us in the studio, and I just love French bulldogs. I think they're amazing characters and great pets, very strong companions to humans, and they're just sweet as sugar and very interesting. So if you're interested,
that's nice to know.
Go get one.
If it's a dog that you are attracted to, I think a benefit of a French bulldog is that they're small, which a lot of people want a dog that's small, but they're very sturdy. So sometimes The negative for some people with a small dog is that they're just too frail or fragile, and they're afraid they might break their legs. Like, for example, even you don't normally let a toy poodle play with a standard poodle because of the risk of the toy poodle getting its legs broken accidentally. Yeah. But the Frenchies, just they're sturdy
little guys. Yeah. Well, they were trained to chase like wild boar and stuff like that. So. But anyway, look into them. If you have any questions, call us at the clinic, and we'll be happy to talk more about them.
Great.
Thanks for calling in, Jeff.
Wait, did you have one other question, Jeff? I'm sorry, I thought.
No, that was two.
That's pretty much it. You've been so much of a help, and if I have any questions, I'll call in.
Thanks, Jeff. And on line 1, we have Lauren. Hello, Lauren?
Yes.
Hey, how are you? This is Dr. Pernikoff and Cindy Vickers.
Hi, Lauren.
What's your question, honey?
Yes, okay, so I'm calling in with a two-parter question today. It's in regards to fleas and ticks and prevention. So my fiance and I, we have 2 smaller dogs at home, and they're primarily indoor dogs. But every year we use a flea and tick preventative regardless. So my first part of the question is, do you recommend a preventative even for primarily indoor dogs?
And go ahead.
Go ahead.
Well, they flea and tick, they're only going to get if they're outside, although you could bring that in accidentally on your clothing, and that might be an issue, especially if you go out in the woods or you're working out in the yard. You can bring ticks in, and they can transfer. So I think it's just a good general rule to do that, and there are a number of products out there. Now, for heartworm, did you ask me about heartworm? I can't remember.
Nope.
Was it just ticks and fleas? So we have a lot of different products available, and every veterinarian's going to kind of pick and choose, and these products are coming out. It's almost like new technology in electronics. Every 6 months, there seems like there's a new product, and now we find that some products and that we've used routinely in the past are starting to develop some resistance in the wild tick and flea populations, like Frontline. So now Frontline's modified their product and they've improved on it, and they have something called Frontline Gold, which you can use in canine and feline, and that's a monthly topical. But what's interesting for me is we have a product called Seresto Collar. It's actually one of the rip-away collars you can put on there. Used to be they weren't very effective, but now these are impregnated with really effective drugs for both ticks and fleas, and it's a little bit cheaper, and that product for canine and feline will last up to 8 months. So, by the time you put it on, you don't have to mess with it. That's cool. Some people are cautious about that in cats that are outside a lot of the time because they can get hung up on a branch or a wire or whatever. And then there are other many products, some that are oral, some that are topical, and they all last different lengths of time. And again, it's really up to you to kind of satisfy that need with your veterinarian. Does that answer your questions?
Yes, but since you brought it up, what would you recommend? Topical, oral, collar? What do you think is the best kind of product?
God, it's such a difficult question to answer, but I personally like the Seresto collars just because I think it's easy just to put the collar on, and especially for inside animals that aren't going to likely be hung up on stuff. But I also, we use, in our clinic, we use a lot of the Brevecto oral. So people are tending to get away. Some people don't like the oil that comes with a lot of the topicals because they need that to kind of be there. And if you can find one that doesn't dry out the skin or doesn't create any irritation, your dog or cat is not sensitive to it, then any of those products can work.
And just one other thing, it's not necessarily for you and your dogs, but it's really important that you not give any medication for a dog to a cat. The cats have very different medication than the dogs have.
Yes, and you also don't want to overdose, so you're always going to use your vet to help you define what product is needed for the size of the dog, the age of the dog, and all those are specific.
So you're saying don't buy it from like a Petco, always go to your vet, basically.
Well, I think so. The problem with a lot of the products that you find at the pet shops and the other grocery stores even, they may not be as standardized. And we see a lot of problems with certain products that like topical flea and tick products that really irritate the animals or can make them very, very sick. And the other point is that some of even the name brand stuff that the veterinarians will dispense, a lot of those have been reconditioned. They might go out of time, and then they are sold to a secondary distributor. Sometimes they're even reboxed and resent with a new date. So you lose the protection a lot of times from the core companies if you're using products that they haven't sold directly to a veterinarian. And I think your veterinarian can probably explain that better. But
Okay, that's really good to know.
Is that good? And I just want to tell you, Lauren. Go ahead, Lauren.
I have a two-part question. Can I ask the second part real quick?
Yeah. Do you have extra money?
Very funny. I just want to know, I'm always trying to debate when is it too soon, or when should I start, preventing, using prevention, for my dogs. Do I start in the early spring? Do I do it year round? This is something I always argue with my fiance about. When is it too soon, or when is the right time to start using prevention for the pets?
Probably get that question every day in the clinic, and I have an amazing associate, Dr. Pam, who always has good answers for that. But what I would suggest is that...
and then is your answer.
Yeah, depends on the winter we've had. So most veterinarians are going to suggest that heartworm preventatives go year-round, and that way you have no problem of missing. It's assuming we have a warm winter, which we kind of did this year, and you may not get a complete die-off of mosquitoes and exposure opportunities for the dog. So that would be one scenario. Now for the flea and tick, I usually tell people, depending on the weather again, to start somewhere mid-March to mid-April. And I think that usually in our area here in Missouri, that's going to cover a lot of the opportunity. And the fleas come out a little bit after it seems to me the ticks come out first, and the fleas are soon behind them.
And heartworm in Missouri is absolutely rampant.
Well, we have so many water systems, river systems everywhere.
Well, I think some people are like, oh, what are the chances? But the chances are actually entirely too great that your dog might contract heartworm, because it really is like if you see a map and they put like red dots about where the heartworm cases are found, Missouri is just essentially covered.
Well, we've had a lot of flooding too, so that's going to just encourage more.
Yeah, so it's a big deal here. And if you've ever seen a dog get heartworm treatment, when they do have heartworm, many of them survive, but it is not a very fun treatment. And then you're also supposed to keep your dog quiet for like 6 weeks. And so it is, this is one, and I'm not, too big on overly medicating an animal, but I'd rather be safe than sorry, because the chances are too great, and the things that you need to do to cure it are just, I know I'm trying to say, are just really not fun, and they're expensive.
Right. Does that answer your questions, Lauren?
Yes, thank you both so very much. Have a great day.
You
Hey,
too.
listen, thanks for calling in, and your voice sounds so familiar, but thanks for being here, okay? And I think we have one more caller. Do we have time for one more call? I believe we do. Okay.
Yep.
And on line 2 is, it sounds like, is it Natalie? Hello? Line 2? Did we lose you? I think we may have lost our second person.
Oh,
So
no.
we'll just have to have her call back another day. I apologize for that. We just got into kind of a wordy
Well, I wonder
question
what she
answer.
wanted to know.
Well, I don't know.
Let's guess. What do you think she'd want to know if we were talking about?
I don't know. One problem we see in the spring is itchy dogs.
Okay.
And
That's a good
people
one.
often ask me, is that seasonal or not? And in many cases, it can be seasonal. And it depends on the individual. And what happens with our immune system, when we stimulate it with some kind of foreign protein or lipoprotein, which is fatty solution mixed in with protein, then our body's immune system starts to record a memory of this. And just like the same reason we vaccinate, the whole idea of vaccination is to stimulate your immune system with something that resembles but isn't the actual agent of concern, the disease, but some part of the disease that's been inactivated, but still creates enough of a protection in your immune system's memory that the next time you become exposed to that, or in this case, the dog becomes exposed to something, he's going to be more resistant and able to fight against any infection. So that's kind of how the immune system works generally.
So I always thought it was a little tiny bit of whatever the
That's why I said
disease
it could be on a virus. It could be part of the viral anatomy that's been denatured or neutralized.
A part of it.
Yeah.
Okay.
There's got to be something that either looks like or resembles the foreign agent that's coming at you.
Well, that was really my question. Is it something that resembles it, or is it it? So it could be either?
Could be either, yeah. I mean, if you're clever enough immunologically and you're making vaccine, you're going to do something that, to be safe, you don't want to put active rabies vaccine virus into the vaccine, right? So you're going to kill it some way, but you're going to preserve whatever those components are, and I'm not an immunologist, but whatever the components of that agent are, that can be enough to stimulate a good immune response by the person or the dog you're giving it to.
Wow, that's one of the most interesting things I've ever heard on the show.
Seriously?
Yeah, I think that's incredibly interesting.
But just the other day I was talking about dating and stuff. That wasn't
at all interesting. Not even sort of.
So that's a good point. And again, a lot of people will see, even later in the season when grasses start to dry out and the animals go down, they'll get a contact dermatitis because they're rubbing on that dry grass, and that can irritate the skin. But
I have seen, this is not a control study, but quite a few dogs that I have worked with who had a lot of problems with their skin. We're talking about, just hot spots and a lot of itchy stuff, improved dramatically when they changed their diet. And
That's a good point.
First and foremost, I would just say absolutely eliminate the treats that are just junky things filled with chemical and sugars, and just dogs love it. It's like crack, and I can't mention any names, but there's some things that are just, look at the label and it's really bad, not real food. And sometimes just taking that out can make a big difference in your dog's skin, quite literally, and the reactions they're having to things.
Well, there's so many
in terms of
opportunities
itching.
for holistic foods now and more natural, organic grown foods. And, the problem we did in veterinary medicine for so many years, we created all these diets that are grain and kibble based. And the reality is the dogs don't know that. It's not familiar to them. And it strikes an immune response that's kind of excessive, which can turn into allergies. And then, so food allergies, as you're suggesting, implying, are one of the more common allergy stimulants we see.
And I think people, and I even think there are vets that sort of dismiss that, and so there's, I think the steroids seem to me like they just get overprescribed, and nobody's really looking at their diet. So if the diet doesn't work, well, of course you're going to do something to try to interfere and stop the process. But I think people should at least take a look at that and try to get things that are just provide no nourishment whatsoever for your animal.
Yeah, I was going to say on the vaccines, I wanted to step back for a moment and remind people that, if a lot of people go to the Ozarks for the summer, or they go traveling and they want to put their pets somewhere, or they want to take them with them, but you want to make sure that you have not only the core vaccines, the rabies, parvovirus, distemper, but you're probably going to be required to get the flu in some cases, the flu vaccine, and also
the flu vaccine,
a nasal vaccine, the Bordetella vaccine. Yeah, the influenza virus that was discovered first in pets around Chicago, and now a lot of places are afraid of the liabilities, so they demand that you have a vaccine for influenza. We don't push it because it's such a rarity, and it's just like the human influenza. It can change pretty dramatically, so you invest in a bunch of this vaccine that you're going to deliver, and then maybe 6 months or 8 months or a year later, it's not the same vaccine.
That's why I don't get a flu shot, for exactly that reason. Is it transferable to humans?
No, these would be viruses are mostly all pretty species specific, and so that's a safety for us.
Well, you have your serious face on now.
I know, because I was thinking. So anyway, that's kind of where we're at. The other big part about I think that's really good about examinations is it gives the vet a chance to get his hands on. And you'll be surprised at how many things we discover that people go, oh, I never saw that before. And, that's what we're trying to do. You might have a mass that is kind of underneath the skin, and unless you're, just grooming your dog at home or you're massaging your dog and playing with him, you may not know that it's there. So take advantage of your veterinarian and make him do his work, and we'll do it up. Okay, so that's all we have for this segment, and I'm going to ask you to return back. We have Dr. Cindy is going to give us
Dr. Cindy, thank you for that.
I just elevated your position.
Yes, I appreciate it.
You're going to introduce a topic for training.
I am.
And it's Dr. Doug Pernikoff and Dr. Cindy Vickers.
Just keep it.
I like it. Sounds
until
good,
I
doesn't
get
it?
caught.
And we'll be back with you in just a moment. Thank you.
Where are you? We got some.
Here we are at segment 3 of Dr. Doug's All Things Animal radio show. Dr. Doug Pernikoff and my great friend and co-host, Cindy Vickers. And Cindy is going to introduce our training session. She wants to talk about... Go ahead.
Coming when called.
Okay, so what does that mean? What are you trying to get at here?
That means you call your dog, you say their name, and you expect them to run to where you are. And you also expect them, when you go to reach for their collar, that they won't take off, because sometimes we'll come up to you and then you go to hook that leash on or get them, and they're like,
They
oh, I
bolt.
don't think so. Yeah, I'm out of here. So I'm going to break this down quickly.
Okay.
And perhaps some people would need more details or join a class, but... This doesn't even really matter if you have a puppy or an adult dog. Sometimes things are easier when you have a little puppy and you start things simply because you can catch them, and big dogs will take off running and you can't catch them.
Uh-huh.
So I suggest if you're going to work outside, you work in a fenced area to start with so that you at least don't lose your dog. So the very first thing that I like to do, or I have two things that are kind of tied for first, is I want my dog to turn their head when I say their name. So that is the beginning of coming when called. It's simply a head turn, and if I don't get that, I'm probably not going to get the dog to continue and actually move toward me. So
Do you want them to stop first wherever they are and then turn around, or you expect them
I just want them to turn their head.
Okay.
So you almost have to stop when you turn your head. Most of them don't keep running and then turn their head and keep going. So
Oh,
we
there's
have
a
a new
treat.
dog, and one of the things I would do is, say their name is Doug. I would squeak a toy, make some noise, clap my hands, and when I'm pretty sure and I want to see if that will get them to turn their head. So before
My wife does the same thing every night before dinner. Go ahead.
Before I add their name, I want to know that whatever I'm doing will probably cause them to turn their head, because I don't want to have any practice of calling their name and having them not turn their head. So I, again, squeak toys, clap my hands, make some noise, see what works, and then I would do that, and I'd say, Doug, and as soon as they turn their head, I'd just say, oh, good puppy, and maybe I would throw them a treat, or maybe I'd just make a little bit of a fuss and just move on. And I would do that frequently. So that's one thing I would do. The other thing, this is one thing that is important, I think everybody knows, is that this is the thing that you don't do. You never call your dog to come to you in any way when what will follow is something that in their mind would be unpleasant. So you certainly don't punish them. But I don't even call them in and I have to leave for work right now, or I call them in to put them in their crate, or I don't call them to me because they've just had a housebreaking mistake and I'm angry about it. Just never, because the dog has every opportunity not to come to you. So if you give them reasons not to come to you,
That's a good point.
it's unlikely that they will when you need that.
So even if them bolting away was the transgression, you're still not going to verbally reprimand them as long as they come back.
Right, I'm not.
Okay.
I'm not in this case. But you would have to look at, we would break that down and go, if this is what's happening and they're bolting and running away, we still have to back up and teach them that coming to me is a really good thing to do. And then things get a little stricter when they really understand it and they're saying, I'm not doing it. But you have to teach the exercise first. So that's one. The other thing I do, which I think is kind of a big deal, is I recommend that people work with a hungry dog. I didn't say emaciated and starving, but I wouldn't feed my dog breakfast and then go out and work and have food. So I would, in the morning, for example, breakfast would come from me, from my body. I'd have it in my hand or in my pockets, and I would go in the backyard and I would just start moving around. And when the dog came up to me, I'd have the food in my left hand, and I would turn my hand backwards and sort of bend down and give the treat to the dog who's got his head sort of like where my knee is, where my left knee is. And then and if I couldn't get my dog's attention, I'd go up to them, show them that I had food, let them sniff it, and then I would walk away. They would likely follow, and I'd bend down and give them food. So I'm facing the same way as the dog. The dog is coming up behind me, and I'm bending it down and giving them food like we're going on a walk. As soon as I give them the food, I might say, good right here, good boy, and then I take off and I've walked 6 feet away in a different direction, and the dog would probably come up, and I would give them the food, and I just keep zigzagging all around the yard and getting the dog having this idea that, oh, this is a cool thing. If I go up to her, and I'm also kind of in walking position, that's where I get my food. And that's how I would feed him breakfast. And you can do this various times.
That's very interesting.
Then the third thing I do that's just a game is, again, you get out the squeak toys or something that your dog likes. And when you're doing this for the first time, you're probably 6-8 feet away and hiding in something that in a very obvious place, like on the side of a chair where they can kind of see you. Squeak the toy because they want to come running for the toy, and then you say, "Puppy, come!" And then when they get there, you give them the toy or you throw the toy, and you make this game. So coming to you again is fun.
It's all reward based.
Yeah, and well, the idea is that to make them understand, they have to get from where they are to where I am. Mm-hmm. And then when they get there, this is going to be really fun, so that they want to do it. Then when I progress to doing something on a leash, I will, and when I know that I can get a head turn, and when I know that I can get them to probably run to me, I would do the same thing. If they are not in the room, I would have their food in their bowl, and I would shake that bowl, knowing they're running to get their food, and same thing, "Puppy, come!" And here's the food, and I give them their food. So now we have moved to like the fourth thing, and we're outside, and we're on a leash, and the dog goes over and like smells the bush, and you are 3 feet away from them. Everyone wouldn't agree with this, what I'm about to tell you, but then I would call them. I'd say their name, and I'd say, "Come." And if they didn't come to me, I would give them a little pop on the leash toward me, right at the same height as their neck, and then start clapping my hands and backing up and making lots of happy kinds of noise. Maybe I'd have a squeak toy in my hand to get them to then come to me. And again, I'm very, very close, so they're more likely to do it. And then as soon as they come to me, like, "Great dog," 3 seconds of big, big praise or probably a treat. And then I say, "Go play," and let them go back to the thing that they were interested in, because I don't want them to think that every time they can come away from something that's interesting because they can go back to it. Gotcha. And then there's a few other things I do, but another one I think is really important. Now, at some point, you've done all these things, and you're likely to get the dog to come to you. And again, you keep them there. I don't ask them to sit. I don't ask them to down. I don't ask them to do anything. I'm very enthusiastically praising them and probably giving them a treat. And by the way, I save treats sometimes only for coming when called. Then we're out in the backyard. I call the dog to come to me, and maybe the dog is 20 feet away. And
do you use a longer, extended leash?
No, when there's no leash.
Okay.
And in this circumstance, I will call the dog to come to me, and I am going to work at this until that dog comes to me. If it takes me 20 minutes, I'm going to go out there until the dog comes to me. So I will call, I will use treats, I will use anything that I can. And when they do, I'm just going to pet them for a moment and let them go. And I'm probably going to try to do that 3 times in a row. Okay. So you have to have time. And then the dog figures out that even when I'm at a distance and I have every ability to leave, she's just not going to give up. So I might as well just go there. And again, I think sometimes they test you, like, this might be the bad time. All I'm going to do, what I do is I sort of walk up to them sideways to get kind of close, and I call them, and I might bend down. I'll do things to make myself look happier or pleasant or non-threatening, so they have a reason to come to me, because Dogs are very skeptical often about this. But when they do, again, it's just like, what a good puppy, and I don't keep them. You only have to stay here for 2 seconds, and you can go. And then you'll start to see that you get a pretty reliable coming when called. But you have to work through these short little distances first, so don't be in a rush to go into a big distance until you've worked through all these 3 and 6 feet distances, and then you go out in the backyard and you just stick with it until they call.
So I have a question.
Tell me come, rather.
Yeah, I have a question about 2 points. When the age of this particular pet, when you start this training,
Any age.
Any age,
because maybe you just adopted a dog, the dog's 5.
That's what I was getting at. So if you have a new dog, then you don't know his history, but you still start the same kind of process.
Yeah, I would do exactly the same thing whether the dog was 5 or 8 or 6 weeks.
Okay. Now, what if you're at that
Don't get
point?
the dog at 6 weeks. Wait till 7.
Yeah.
Just
Or
saying.
even 8, some people.
Yeah, but not 6.
So let's say we got the dog to that point where you're off the leash and you've got a fairly good, consistent response to your call, and you feel like you're getting the dog trained, and then all of a sudden a rabbit bolts by and the dog's gone. So do you set yourself back to a certain level and start continuing on again, or do you just assume that was a fluke, or how do you prevent them to responding to other stimuli besides you?
I really wish that you didn't ask me that question, because what I think the real answer
good
is
question.
very, very, very unpopular. So I'm going to say this. I have personally never met anybody, even amazing trainers with great dogs, who you could 100% count on for coming when called when they're off leash in environments that are super stimulating, like rabbits running around or other dogs. And I'm talking about extremely well-trained dogs. That is, the opportunity is too great, and often they'll go, I'll be back, but right now I'm going to go chase that rabbit. And the only time I've ever seen that be really, really consistent, I'm begging for forgiveness right now, is when they're trained on a shock collar. And I'm saying that I have seen that done very, very humanely with a baby, teeny tiny shock that has worked really well. But you better know what you're doing. And
that's the problem if they sell those shock collars at the pet shop.
Because you really need to
guidance.
understand, know, what comes before, what comes after, when you would use it, using the least amount of. I mean, it should be. You should be able to do just just a little
almost the alarm,
a buzz,
yeah.
Not really a shock, and then you need to know what to do exactly after that happens. So that's why I'm so hesitant to say that, because I think they can be used very well and very, very humanely, and it is not your first recourse.
Right. I guess it's dogs that are really persistent and stubborn, or whatever you want to call it.
I know lots of little dogs who absolutely, no matter what, they will come when called. But some of the dogs that are hunters and sporting dogs, they're just like, hey, listen, I got to go. I got to go get that rabbit.
Oh, I thought you had a break to go.
Oh, no.
Oh, okay. Do
you want me to talk more?
No, I thought it was excellent. It was a lot of learning. It was really good. And I mean, those are common sense things when you hear somebody of knowledge speaking about them, but they're not things we intuitively grab to.
Everything about dog training is very, very logical, and none of it is rocket science. It's just science. It's just about breaking things down into small little pieces and knowing what it is that you're trying to accomplish.
Well, thank you, Cindy. That was Cindy Vickers, and this is Dr. Doug Pernikoff of All Things Animal Radio Show, and we're going to take our break right now. We'll be right back with a recap on what we experienced today. Thank you very much.
And Scooby-Doo, if you come through, you're gonna have yourself a Scooby snack. Scooby-Dooby-Doo, here are you.
Yogi Bear is smarter than the average bear.
Hey folks, we're back for our recap last segment of the show today. We've had a great show, thanks to Cindy Vickers.
And Dr. Pernikoff.
No, thanks to you.
Okay.
And Cindy gave us a great introduction to how to train an animal to respond to you, a dog in particular, when you're out training from the beginning to releasing the dog, and that was an amazing presentation.
Or your pig.
Or your pig.
Llama.
Alpaca. or my child. I can't get them to listen to me either. But and then the first part of the discussion was all about the purpose of annual examinations and what the vet can offer you. Again, a lot of things are going to be form fit to the vet and the program that he likes to introduce. So you need to get educated. Or she. Yeah. So whatever. And
It's a good thing I'm here.
yeah, it's true. And I think there's so many good things, but most important for me as a veterinarian, again, is that when I get my hands on a dog or a cat, I get a chance to find things that the owner isn't going to look for. I can't tell you how many times I've opened up a mouth to check the teeth, and I find a tumor in the mouth someplace that needs to be addressed right away. So a good examination, allowing your vet to do as much as they can do, I think is a really important thing. And finally, I wanted to ask if the young lady, Cindy, would you give us some events that are ongoing that are related to pets?
Well, let's see. Today is Slobberfest, and we talked about that a few weeks ago. It's at the Kennelwood, South County location. I think it sounds like an incredibly fun thing. So,
do they go slobber? Are they going to go swimming and stuff? Or?
Yeah, they're going to. You just go and there's big dogs that slobber, and you stick your hand there, and they slobber on you, and then you get to wipe it off with a fancy paper towel.
Oh,
no, there's all kinds of adoptions and events and. I mean, this one sounds incredibly interesting. Go to Kennelwood's website, and it's 2 pages of just different things that they're doing there. Yes, very cool. And then, of course, Bark in the Park, which is the Humane Society's biggest fundraiser and event of the year, is May 20th. And then when there's also May 20th, I think it's Bring Your Dog to the Ballpark. And apparently there's a designated section for that and sort of special tickets. And
well, if it's really hot, if you
I'm going to say.
Yeah, we're not real excited about that.
Yeah, we're not
event.
thinking that's a great idea.
Well, again, people have to be cognizant of a little bit of heat goes a long way with
and tight quarters.
tight quarters.
So
Animals are going to react with one another differently and probably inappropriately. So you don't want kind of fights breaking out and stuff. So, if you want to try it, Just be really careful, cautious. Make sure you have control of your dog.
And know your dog really well. If your dog is a dog that can handle being in very close quarters and
With lots
and
of
the
other
heat.
dogs. Yeah.
And
don't feed them a bunch of hot dogs.
bring wipes,
Yes.
baby wipes and paper towels.
Is that for the owners? Or
I'm going to say dogs on that one.
Okay. We've had a great show, and I just want everybody to know if they need to get a hold of Cindy. She's an excellent trainer. You can call our clinic, 636-530-1808. That's 636-530-1808, and ask for Cindy Vickers for training. And if you have any other questions about your pets, you can ask us there at the same number at the Clarkson Wilson Veterinary Clinic, or look at our website, www.clarksonwilsonvet.com. Next week, we hope to be, again, still searching to have this special guest. We haven't been able to grab him. His schedule's tight, but if we get him in, it'll be great. And I also want to be talking a little bit about shampoos and grooming options for your pet. I have a lot of people ask me all the time, what's the best shampoo? What's the proper thing to use on my dog? How often should I bathe?
What tools to use?
What tools to use? And there are a lot of questions about grooming. You just shouldn't take it lightly. You want somebody who knows what they're doing. And that's what we have to offer today. I really appreciate everyone's participation and visiting us. I want to thank our callers for calling in, and we always welcome that kind of interaction. And I guess that's about the end of it. Cindy, do you have anything you want to say?
That's all she wrote.
Okay, and Cindy says goodbye. And we want to thank our listeners, Dr. Doug's All Things Animal Radio Show. We'll see you next week. Bye.
That's in Jellystone Park. Yogi has it better than a millionaire. That's because he's smarter than the average bear.